My name is Georgia Roark. I am a 5th semester nursing student. Today is September 18th, 2019, and it is 2:45 in the afternoon, and today I will be doing insertion and removal of a Male Foley catheter. So beforehand, I want to make sure that I assess for a physician's order to place the catheter and the catheter size, as well as assessing my patient's condition, last void time and amount, as well as any allergies my patient might have, especially to latex or betadine, because those will be used. So I'm going to go ahead and get started here. Hi, Mr. Jones. My name is Georgia. I'm going to be your nursing student today. How are you doing? Good. I pull the curtain to provide for privacy. Mr. Jones, can you tell me your name and date of birth? Perfect. I'm going to raise the bed to my waist level. I'm going to tell my patient, Mr. Jones, the doctor ordered for us to put a catheter in today, okay? Lay him down in the supine position. I would tell him what exactly the process of putting the catheter in and why we're doing it. And I'm going to go ahead, Mr. Jones, I'm going to expose you, okay? Expose my patient. Brought a bath blanket to provide for as much privacy as possible. Okay, so I'm going to go ahead and put him in the frog leg position. Okay, now I'm going to go ahead and put on my clean gloves. I'm going to go ahead and do perineal care. So if my patient was uncircumcised, I make sure to pull back the foreskin before cleaning it, and then put the foreskin back at the end of the catheterization and cleaning. So I'm going to start by taking my clean wipes and starting at the top of the urinary meatus and doing a circular motion all the way down. I'm going to do it 3 times. Mr. Jones, are you doing okay? Good. Okay, I'm going to go ahead and take off my gloves, perform hand hygiene. I'm going to go ahead and move my wipes and gloves out of the way for the moment. I would want to make sure before starting everything that my table is clean. I'm going to go ahead and set up my sterile field in the bed, starting with it away from me, and then to the sides, and then towards me. Perfect. Now I'm going to go ahead and put on my sterile gloves. So I want to make sure, I want to check the expiration date, and I want to check that they haven't been opened and tampered with. As well as if my patient had a latex allergy, I'd make sure I'd get latex free. Go ahead and open my gloves, making sure not to turn my back to my sterile field. I have a 1-inch border. So I do my dominant hand first. And leave it, and then my non-dominant hand. Okay, I'm gonna go ahead and fix my glove. It got really turned around here. Perfect. Okay, now I'm gonna leave it because I don't want to touch the bottoms. Okay, so now I'm gonna go ahead and get my administrative drape ready. The shiny side down. Making sure not to contaminate me, anything around me, and lay it and leave it. Perfect. Okay. So now I have my sterile field out and ready. I'm going to go ahead and prepare my supplies. So I'm going to open my cotton swabs, get those ready. As well as my lubricant opened, ready to go. Making sure not to contaminate my sterile field or putting my hands below my waist. And I'm going to go ahead and hook my syringe up. going to go ahead and have my lubricate my top of the catheter, 6 inches. Okay, so this container here is if I needed to collect the urine specimen and I don't, so I'm gonna go ahead and get rid of this. Okay, so now I'm gonna go ahead and this hand here is going to break sterility because I'm going to hold the penis while I clean it. So I'm gonna go ahead, grab I'm gonna do the same thing as I did when I cleaned it. And I'm going to start at the top of the urinary meatus and work my way down in a circular motion, making sure not to contaminate my sterile field. I'm going to do this 3 times. Perfect. Okay, so now I'm going to go ahead and pitch this as well. Don't need it. And then I'm going to go ahead and get my catheter ready to insert. Move this closer to me because I still have my 1-inch border. I'm going to go ahead and wrap this up. I'm going to tell my patient to take some deep breaths and bear down like he's going to void. Mr. Jones, you're going to feel some pressure. I'm going to go ahead and insert it. I'm going to go 7 to 9 inches for a male with that lubrication of 6 inches. When I see urine, I'll go another 2 inches. And then whenever I get there, I'm going to take my non-sterile hand and hold it 1 inch from the site, and I'm going to inflate the balloon. So my syringe, the protocol is 10, so that's good. We have 10. I'm going to pull, make sure there's resistance. If my patient were to have pain when I was inserting it, I'd make sure to deflate the balloon and insert it 1 extra inch. So I'm going to go ahead and detach this and pitch this. Okay, so now I no longer have to be sterile. I'm going to go ahead and assess. I would want to assess the amount and color of the urine that comes out, but I'm going to go ahead and clean up my patient because those cotton swabs would usually be betadine, but for the purpose of our mannequins in this video, I used cotton swabs. So in real life, I would have betadine everywhere, so I'm going to go ahead and clean that up with my wipes and gloves. I take my wipes, just like I did the first few times, and I would start at the top and I'm gonna work my way down, cleaning it all up. No longer having to be sterile. I just don't want to mess with the catheter. Do it 3 times. Okay, clean that up. Okay, I want to make sure that I take my catheter back. I want to secure it to the leg where there's slack so it doesn't pull. I also want to make sure there's no loops of any sort. I want to clip it to the bed sheet here, and then I'm going to take the bag and put it on an immovable part of the bed underneath. And like I said, I'd assess the amount and color and characteristics. I would take my little tag here and I would do the date and time of the insertion and my initials. I'm going to clean all of this up. And I would throw this away. I put this in the dirty linens. Make sure my patient's in a comfortable position. and then I would go my patient back down to a low. And then I would go out, excuse me, set him up a little bit, make sure he has his call light and everything. Mr. Jones, is there anything else you need from me? Okay. I would make sure I would clean up my mess before I leave the room, perform hand hygiene, and then I would go out and document the time and date of insertion, the size of the catheter inserted, how my patient tolerated it, and he tolerated it well. Then I would also document the characteristics, the amount, color, and smell, or any other findings of the urine. So this would all be cleaned. Clean up the room. So now it's a few days later. My doctor has an order to remove the catheter, so I'd come in and let Mr. Jones know, Mr. Jones, the doctor's ordered for us to remove your catheter, and tell him why. I'm gonna raise him back up. Lay him back down in the supine position. Mr. Jones, are you doing okay? Good. Mr. Jones, I'm gonna expose you now, okay? Perfect. Okay. I'm gonna go ahead and get my clean gloves on. I wanna make sure that I bring an empty syringe with me, and I have one right here, which is good, to deflate the balloon. Mr. Jones, I'm going to expose you. And I brought a towel to put under him for any leakage or drips or anything that come out with the catheter. So I'm just going to put this underneath him here. Okay. Excuse me. Okay. Mr. Jones, I'm going to deflate the balloon. First, I want to detach it from the bed sheets. I'm gonna get that in a minute. Okay, so I'm gonna go ahead and deflate the balloon. So I want to check how much was inflated into the balloon. I had 10 milliliters, so I want to make sure 10 milliliters come back out. Perfect. Okay, so now I'm going to go ahead. Mr. Jones, you're going to feel some pressure, okay, as I pull this out. I'm going to pull it out in one quick swoop. Okay, I'm going to examine the top of the catheter to make sure that the balloon is intact, that there aren't any pieces missing. It is intact, which is good. I'm going to wrap all this up. I'm going to assess the color and amount and characteristics of the urine that is in there whenever I go to remove it. I'm going to throw all this away. I'm going to go ahead and clean Mr. Jones up. Same way I did before, starting at the top and working my way down in a circular motion. Three times, getting good and clean. Okay, perfect. I clean up all of my mess, put this in dirty linens. I would let Mr. Jones know you might have some burning or pain the first time you go to the bathroom, Mr. Jones. And if you need anything, you can call me on your call light and get him comfortable again. I'm going to let him put him back down in the low position and set him up to where he's comfortable. Is comfortable, Mr. Jones? Good. Okay, so then I would clean everything else up. I would do hand hygiene, and then I would exit the room and go document the time and date of the removal, how my patient tolerated it, the amount and color and characteristics of the urine that was in the bag, as well as if the balloon was intact, which it was. So I would document all of those things.